Welcome to Bloom Into Your Soul, a podcast for mothers who are mothering themselves as they raise children, reclaim their mental, physical, and spiritual health, and rewrite the story of their life by living from their wholeness and in their essence. I am your host, Jeanette, a mother, poet, highly sensitive, creative, and guide with a deep passion for ending generational cycles and revolutionizing motherhood. Thank you for coming along for the ride. It is my hope that the guests that come into this space, along with insights I share, can awaken your curiosity to reclaim your own life on a mind, body, and soul level. Hey, what's going on, you guys? Welcome to another episode of Bloom Into Your Soul. I am your host, Jeanette, and I am so excited that you are here. In today's episode, I sit down and speak to Margolis, who is a licensed certified nurse, midwife, licensed FEME, teacher, certified clarity breathwork practitioner, yoga teacher, practitioner. She is a third generation guide to mamas birthing babies in her family and has helped thousands of families in her 25 plus year midwifery practice and has personally ushered the birth of over 1,000 healthy babies in the world. She has also guided countless human beings to heal from emotional pain, inner stress, and trauma, tap into their strength and power, live fully and vibrantly, and reclaim their radiance, joyfulness, calm, and overall sense of well-being. Through her online childbirth course, Love Your Birth, her online in-person midwifery for pregnancy and postpartum support coaching, her birth professional mentoring, holistic gynecology, clarity work, and yoga, FEME experience offerings, she infuses wisdom, compassion, inspiration, and joy into the entire process of women's health care from teenage years to menopause, as well as facilitating incredible healing and wellness for both men and women of all ages. Anne is 2 times #1 national and international best-selling author of Natural Birth Secrets, an insider's guide how to give birth holistically, healthfully, and safely, and love the experience, and also Trauma Released Formula, the revolutionary step-by-step program for eliminating effects of childhood abuse, trauma, emotional pain, and crippling inner stress to living in joy without drugs or therapy, both out in 2nd edition. Anne's work and insights and advice have been seen on TV shows and movies, including 4 episodes of A Baby Story on TLC Discovery Channel and the award-winning feature documentary Orgasmic Birth and Human Longevity Project. She has been interviewed for multiple local, national, and international radio programs, shows, and podcasts. And Anne has midwifed mamas and babies for over 2 decades and guided individuals to birth themselves as healthy and whole human beings capable of immense joy and inner peace. Her clients describe her as passionate, sensitive, big-hearted, and a playful ball of light. When she's not helping mamas around the world, you can find her doing yoga anywhere and everywhere, dancing, riding her bike, paddle boarding, swimming, taking or facilitating powerful growth and healing workshops, enjoying family time, and watching comedy and historical drama. Anne is just such an amazing person to have a conversation with. You can tell in my voice how excited I am for you to listen to this episode. This birth trauma and trauma in general is one of the reasons why I show up to do the work that I do for mothers, but usually my drive is behind it all is the children, the babies, and this episode is just one of my many favorite So I hope that you enjoy and you let me know what you felt moved you, and share with me over on Instagram once you're done listening to the episode. I cannot wait to hear. Enjoy the episode. And thank you so much for being on Bloom Into Your Soul. It's such an honor to have you.
Yeah, it's an honor to be here.
Can you tell the listeners what it is you do?
I wear a few hats. I am since 1995 been a very busy holistic nurse midwife, and so that helping moms and babies through that whole journey of planning a pregnancy, being pregnant, birth, postpartum, and also well woman gynecology. And through that, through helping them, and also kind of through helping myself, I became a yoga teacher. I was always an avid I practiced yoga, but so many of the moms that come to, and their families are stressed out and they don't have a way to tap into and ground, and it helps so much with in pregnancy and in birth, so I became a teacher, and then I started incorporating that in how I help the families in my practice. And then when did it must have been I don't even remember how long ago that I went through something really tough. One of my daughters had a terminal illness, and thankfully she's okay, but it was 8 years of hell, and I had to really midwife myself, and I went to I wasn't feeling right, and I didn't know what was wrong, and I stumbled upon I'd done different modalities, and actually I ended up an integrative psychiatrist said to me, what you have is chronic PTSD, and it spent an hour and a half with me and listened to, what I was saying, coming from childhood and different traumas as an adult, and now my daughter being sick. And the way to treat that is not through therapy, not through all the different things you've been doing, homeopathic remedies and herbs and medication, that's treated, that's trauma that lives in the body. It needs to be released through somatic experience or some sort of body experience. And I was so happy to get a diagnosis, or at least something to know what was going on with me. But what was amazing is that soon after that, my friend and I went to a yoga retreat, and on that in Costa Rica, and on that retreat was a breath worker who was and people were raving about sessions with her. This was like 20 this was a long time ago. They were saying, oh my God, like they felt like tons of trauma energy just left their body, and whatever they said, I was like, oh my God, I have to go. So that was the first appointment that like literally saved my life. And I became so like, I wanted to know what was happening. Like this lady that was guiding me through the session, because I knew breath work. I was a yoga teacher, right? But this was a different type of breath work. And I wanted to know, it was such a powerful experience. I wanted more of it. And I also wanted to know what drugs she gave me, because it felt really like a transcendental out-of-body experience. So she says, no drug, it's this is the type of breath, rebirthing, this is the type of breath work. And anyway, I needed more of this. So that fueled my passion also to get trained in it, because so many of the moms in my practice come to me with birth trauma of their own from a previous birth, or other traumas. 1 in 3 women have been sexually abused, and any kind of thing that's a trauma. Could have been the loss of a parent at a young age. Any kind of emotional upset that they never processed is considered like a trauma. Being in losing somebody in 9/11, or being bullied as a child. So I wanted to help them. And it's interesting, holding space to help a person give birth. It's very similar to holding space for someone to rebirth and heal, right? And release the traumas and pains. They don't have to know the story. It's just about getting into that deep subconscious state and taking in, this breath, which has a physical and emotional and spiritual component, energetic component to it. It's very, people can say the same things when it, like, I can't. Oh my God, what's happening? I'm going to lose control. I don't like the feelings I'm having. I'm going to die. They say that in giving birth, and they say that if old traumas, may come up, and I'm like, I got you, I'm not scared of their fear. I know how to, it's just it's just sensation. Breathe into it, relax with it. That's the key to your salvation, is sort of just encourage it, love it, bring it on. Right. And that's where the healing comes, and the release and all that. So so I'm a breath worker as well as a midwife. And yeah, I've written books about it. I do it, I practice it, and I lead sessions, and I've done retreats and all workshops, things like that.
And like you said, it all ties together. Like,
it really does.
Yeah. Because
it really does.
Yeah, we're going to talk about birth trauma today and what it is, but I wanted to know, how did birth trauma impact you? Can you share a bit of your story?
Sure. So I became a nurse before, obstetric nurse, before I became a midwife. So in the 80s, late 80s, I was working as an obstetric nurse, but also pregnant with my, at some point, after a few years of that, I was pregnant with my first baby. And that's where I sort of developed fear of birth, was in the hospital, because all these people were just walking in, and like, I was seeing these horrible things happening, mostly from the interventions that were being done. And I saw way too many, operations, cesareans, and I was very active, and I was very afraid of having major abdominal surgery. And I didn't hear of a midwife then. We didn't have them in our hospital. So I just went with the doctor, and I was really scared, and I didn't know, we didn't have internet, right? I didn't know, like, I knew that, I took Lamaze, but I didn't realize that, what it was to actually experience how you're treated, right? So I walked in, and I got the royal treatment because I was a staff person on their staff having a baby, but, told to put on a hospital gown. Who thinks that's that's like an innocuous thing? But then that, like, sort of disempowers you and makes you feel like a patient, impersonal. It's like impersonal, like a factory line, or that you're sick.
Yeah.
And then you're told, I was told, like, everybody, like, we tell everybody, you have to be on your back, and you can't eat. IV, we have to have an IV, you have to be attached to continuous fetal monitoring. And now, no animal, I didn't know that then, but we know now. I mean, no animal could labor that way, so of course I wasn't laboring normally, right? You put any animal in that situation and labor will stop. So of course I wasn't progressing. And I heard, and the doctor kept coming in without even asking, and giving internal exams to me, and saying, oh, and walking out, she's still 4, she's still 4. And then the nurse, I heard him say to the nurse, my colleague outside, give her Pit. And, most moms don't know what that is, but I know what that is. That's Pitocin. That's a medication to make everything stronger, more intense, more fast. And it has all kinds of, risks to it. And I didn't want that, so the nurse came in, she was about putting it in my IV, and I'm like, I don't want that. She meant well. She says, but honey, you don't want a cesarean, do you? And so, like, no, I'm vulnerable in that situation. So of course I know I don't want a cesarean, so she gave me the Pit. And of course my Lamaze went out the window. Then I couldn't cope with it. It was much more painful and intense. And then they had to give me an epidural. And then my baby's heart rate immediately dropped. So that caused the crisis that I didn't want to have in the first place, which was an emergency cesarean. So I was whisked off, and I see all these panicked eyes around me, and, everyone's dressed in that, and looking like someone's going to die. and I was rushed into the operating room, and then everybody left me alone. So I was waiting to be operated on, and no, like I was looking at the clock. I know that when a baby's heart rate is that low, they have 10 minutes to get my baby out, right? And no one was monitoring my baby, and no one was coming in. So then I'm seeing 10 minutes, 20 minutes, a half hour. So already my baby's damaged. I'm out of here, and then my baby's dead. It was an hour where, I don't know, some miraculous, the epidural took effect, and my body started pushing. So I'm screaming for help, and the doctor comes in a panic. They were waiting for the assistant surgeon, who never came. And, here I am thinking I'm in a hospital. I'm supposed to be safe. My baby's supposed to be safe, right? Well, so he cuts a big episiotomy. He's screaming, grab me a vacuum, and he vacuums her out, and I left my body.
Yeah.
That's a normal trauma response. It happens in rape and accidents and all, it happens with that. We study trauma from, we learned trauma. We started studying research on trauma, started with the VAs coming back from the war, the vet war in the 60s. But we also study a lot of trauma through animals, how they behave. And we have that same reptilian brain. We have the same trauma response, and so fight, flight, or freeze, and disassociate. You're just disassociated. You left your body. It's almost like
you're floating.
What?
It's almost like you're floating.
Well, like for an animal, for example, if an animal is going to be eaten by a tiger, like the deer is going to be eaten by a tiger, if the deer either is going to run, it's not going to fight because it's going to lose. So if it has no chance of running, it's going to freeze. So it plays dead, and it's almost anesthetized. If the tiger eats it alive, it won't feel it as much. It really, the organs shut down so that the tiger will think it's dead, and we'll go look for another animal for tomorrow's dinner because it knows it has this one, and that's the tiger's last chance to escape, the deer's last chance to escape, and then it will run. But all animals, when they get out of that trauma, they just shake it off. They just shake, and then they resume being in the parasympathetic, calm, alert state. And that stress response doesn't stay in the body, right? But anyway, I didn't know I had birth trauma. I was just out of my body. I didn't want to see my baby. And they're like, look at your baby, she's fine. And I was so, something really happened to me there. I mean, I was traumatized, right? And so then, now I'm looking back, the hospital misdiagnosed my baby's fetal distress in the first place. But that's a whole other thing, because how could she be fine if they were saying her heart rate was dangerously low? But that whole experience and my symptoms afterwards were classic PTSD, and now what they're calling birth trauma, which happens to about 45% of women giving birth in the United States. It's staggering. It's staggering. So that fueled my seeing what I was seeing in the hospital, and my visceral experience of birth trauma fueled my passions to, like, we got to do something to prevent this. So my friend had said to me, did you ever think of becoming a midwife? And I literally said, what's that? I really didn't know. This was, in the 80s. And she's, but she said, go to the library and read, so I went to the library, and I was like, oh my God, I'm home, and I went to midwifery school, and I graduated in 95. And I'm really, that's my passion, is really to prevent birth trauma in the first place, but if it's there, to help people heal.
Right. So for those of us who have no idea what trauma could look like besides leaving the body, what are some of the things for those of us who have already given birth? How can we identify that we've had birth trauma?
For mothers or for babies?
For mothers first, and then we can dive into the babies.
So mothers can have terrible anxiety. They can have nightmares. They can have recurring thoughts of the birth. They can be triggered into a stress fight or flight response. If they see anything that reminds them of a birth, if they see a pregnant woman, if they see a new baby, if they see somebody wearing something that looks like someone was in the, I'm just saying, like they can easily get triggered in, and having panic attacks, insomnia, and really feel out of sorts, like something's really wrong with them. And people, and the worst thing that people say, well meaning, is, what's the matter? You had a healthy birth and a healthy baby, so it's been, the trauma of a birth is very similar to the trauma somebody feels after being raped. And it's been coined that way from, there's organizations like the World Health Organization and it's called obstetric violence. It's very intimate. It's done, there's a lot of, high peak emotions going on. Things are done without consent, life or death. And so it has a lot of the similar, reactions, and trauma can also cause, all sorts of, physical, if it's not resolved, it can cause physical ailments, but usually it's that disassociation, not feeling right, recurrent anxiety and recurrent intrusive thoughts of the situation, not wanting to talk about it, not wanting to go near it because it triggers, any kind of reminder of it. And it's a problem sometimes with bonding because anytime you look at your baby, you remember, and then that's that triggered response again. And then you feel guilty because you should love, you want to love your baby, and you want the baby to be a positive association for you, so people have different, I would say, expressions of it, but I would say that's in general, the common, how it can commonly express itself. And night terrors and.
And what about the babies? How would it express themselves in the babies?
Well, okay, so yeah, babies are fully, we know now from neuroscience and embryology and psychology and neurobiology, there's a lot of research to now that documents that babies are fully conscious in the womb. Like just how we knew, when you smoke a cigarette, it affects the baby, right? When you take this medication, it affects the baby. There are medications, there are viruses that actually, will cause horrible, terrible harm for the baby. So it makes sense that if a mom is feeling intense stress, like inside, not what's going on outside, because people could have a very, looks like appearingly, on appearance, a very calm life, but inside they're in a hell of trauma and stress and angst, but people can be living in a very it's what appears to be a lot of stress, but inside they know how to, they're in calm, they're zen, right? So the happy emotions, that the hormones of happiness, the hormones of joy and calm and laughter cross the placenta into the baby, just like the hormones of stress and fear and terror and all the depression and all so the placenta is just those emotions have biochemicals that cross over, right? Forget energy. I mean, we all there's a lot of talk about that, they get the vibes of energy, which is not just biochemistry, but thinking how routine, I mean, 1%, it's growing, but of people are having home births in the United States. That means 99%, it's growing, but 99% are having births in the hospital. So the typical birth in the hospital is that moms come in and a lot of times they're given medications to, like they did with me, make the contractions stronger, induce labor, so the baby wasn't ready to be born yet, and they cause these medications are given to the moms, which cross over to the baby to bring labor on. The water is broken, so suddenly the amniotic fluid is just gone, right? Sometimes little electrodes are put on their head to monitor the heart rate. There's things that are just done, routine procedures that are done And then there's drugs given so mom can deal with the pain of all that. That crosses into the baby. And I've seen adults express that in healing, that happened to them, that their body, and it came to them that was what was going on, right? Forceps, vacuum, what's that like? As soon as the baby's born into, so it's dark and warm next to mama's heartbeat, and it's quiet, muffled sounds. And as soon as baby's born, there's loud noise, there's bright lights. Babies are handled in a non-trauma sensitized way. So most people, even if they're well-meaning, they're not sensitive to the fact that the baby's very alert and conscious of what's going on. Tubes are put down their respiratory, the upper respiratory tract to suction out the lung fluid. Bulb syringe is stuck in their mouth to, they're put antibiotics in the eyes so they can't, they suddenly, they can't really see what's going on. And, they're handled in certain ways. There's different newborn procedures. So taken away from mother and put into a nursery with a lot of other screaming babies. I mean, it's just bright light. Like there's so much that's just happening in normal birth. I mean, just think, what is that like for a person who's a human coming from the womb and into the world, right? So if people are trauma sensitive, because the baby has a very sensitive neuropsychology, psychological developmental system, right? And they're very, and we're not even talking about circumcision, or if there's a complication where they need to be resuscitated, or they have to go, into the intensive care, because that's a whole other, level of invasive stuff going on. And even if it's necessary, it can be done in a trauma sensitive way, right? So just take the difference of that situation. And let's say if someone is going to a midwife or having a natural birth or a home birth or a birth in a birthing center, it's going to be very relaxed, dim lights. There's no intervention. The mom goes into labor when she goes into labor. When the mom and baby are ready, the water breaks on its own. She's having a natural labor. Babies can handle, moms can handle a natural labor. It's just, and then, it is a big event for the baby to be born, but the baby's born and placed on mom's chest, right? And just skin to skin. And there's no poking and prodding, and the lights are dim, right? And that baby doesn't leave the mom. Even if the baby needs to be examined, it can be done with the mom there. So, there's a lot of love and it's just human, human compassion for the mom and the baby in that situation. And that enough is just so healing. And that prevents a lot of the birth trauma that's been, that from, a few generations of a birth in the United States. I mean, you could just see that. Can you just see the difference?
Yeah. The difference for me felt like safety is one of them and fear is the other. Like in the baby, putting myself in a baby's position, safety would be staying close to mom. And how beautiful is to transition into the world like that.
Yeah, well, so all the babies in my practice, that's how they transition. And now sometimes sometimes complications happen and emergencies occur. And I have to, let's say, for example, I have to resuscitate a baby, right? Here's another thing. What's done routinely in hospitals, despite all the evidence against it, is baby's born, a third of the baby's cord blood, is baby's blood, backs up into the placenta during pushing. And after birth, that third of the baby's blood supply, which is equivalent to a hemorrhage no one sees, cords cut immediately. So the babies go, it's like their air and their oxygen was just taken away. That's how they're breathing, through the cord. I see it all the time, when I do hospital shifts and the cords, especially after a cesarean birth, because midwives, in New York, we can first assist at the cesarean, and those cords are, I speak about general cesarean all the time, but some doctors, they'll just cut right away, and you see the baby, it's just now they need to be resuscitated. But all the studies and research are now saying, who invented this cord, cutting the cord, that a third of the blood supply needs to go back to the baby. It helps the baby get oxygen and blood volume and nutrients and stem cells and antibodies. So it can, not just transition into life outside the womb, but long-term, right? Long-term health. So that's huge, right? So we're not cutting cords at home. So we don't have to resuscitate many babies. The babies, and we're not giving drugs. So it's just a whole different experience in an out of hospital or birthing center type of environment. That's a big one. So what made me think of that? You had just, I don't remember what you just asked me. But it's just like a whole different, it's just a whole different experience, right? So I know, even if there's a complication, like I have to resuscitate a baby, I'm talking to the baby. The baby, they don't speak English, but they have nonverbal. They get the vibe. So, we're talking to the baby. We got the baby's name. If there's a name, come on, we're just trying to help. I know it's hard. You've been through a hard, you're going through a hard thing, but come back. And, it's the way you handle, even in an exam in pregnancy, before I put my hands on that mom's belly, I ask the baby, I tell the baby what I'm doing. It's just, baby's here. They may not understand, but they get the vibe. And I rub the mom's belly where the back is and the baby's head and the butt. And, I just tell the baby what I'm doing. And, it's a soft sort of, how do I explain it? It's a trauma sensitive way to provide care, so that the baby's entrance into the world, so that the mom's experience of giving birth is as, healthy to me means not just a beating heart and a breathing person, but mind, body, heart, spirit, energy, experience as possible, right? Because these traumas can linger and cause dis-ease later on in life.
Mm-hmm.
If they're not resolved. Right. So for a baby, for example, will be jerky and startly, very easy, hard to settle. People say, oh, my baby is just colicky, and they blame it on gas. Well, sometimes it's gas, but a lot of times, especially babies that come out of intensive care, they're so used, they're just constantly being prodded and poked and bright lights. And they just have a much more of a startle, a fussiness, hard to, not consolable. They're not at peace, and that's a baby that needs, can be guided to heal. There's so much healing. There's so much resources for that. But, just holding that baby skin to skin, being close to mom and dim lights and, slow, soft, quiet noise. And just telling the baby, you're safe, you're okay, I'm with you now, you had a hard time, just acknowledging and just talking to the baby that way. It's the best we can do. So we don't have to come as adults and have to deal with all the trauma from our births.
Right. Because I feel like a huge part of our society is dealing with trauma because of the way we entered into the world. Yeah. And so when you talk about how sometimes we need interventions, and you said for the baby, like you tell it what you're doing, you're explaining to the baby, like what about?
And acknowledging that, wow, this is tough. It might be scary not to be able to breathe. Well, I'm here to help you, just reassuring the baby. Mm-hmm. I've got this, I've got you. Come back. It's safe to be here, whatever comes into my mind at that time, depending on the situation.
What about for the mothers? Like, what are things that we can do differently to prepare ourselves to not have such experience? Like, how can we birth in our power, basically?
Yeah, well, that's why I created my online Love Your Birth course and wrote my book, Natural Birth Secrets, in the second edition. It's all, it's all about that. Take back your birth, get informed, get educated about what, what's going on in your body, and what's to expect from modern medicine, and make a, what are the 50 different interventions that are going to be, done to you, if you don't speak up. And develop this mindset shift and this empowerment that, wait, this is my body, this is my birth. They are not my authority, as the hospital and the staff and the midwives and the doctors. I have a legal right to say, I want this or I don't want this. Right. It's not, planning in advance, preparing in advance. Like this is, deep into my course, but, making a plan of what you want, and discussing it with your provider, then you'll see, am I in alignment with my provider in my setting, or maybe I need to switch providers and settings, right? So you can be in a place with a provider that will give you the kind of care, like I don't just like, for example, no provider should just come and come in and do an internal exam without asking the mother's consent. First of all, she may not want an exam. It's not even necessary, these routine exams in pregnancy, and so this is everything is a discussion, I would recommend some blood tests, even in the beginning of pregnancy. So do you want me to do it? Do you want me to use, we could do it here, or I could give you a prescription. These are the tests we're doing. I want, it's collaborative. I'm not the boss. I have expertise, I have training, but I'm not the boss. She's the boss. The mother, the person giving birth or having pregnancy is the boss. So, this is the time where we test for this, this is the pros, these are the cons, because a lot of the tests are elective. Some people don't want genetic testing and they don't want screening for Down syndrome. And some people want it, it's not, we're going to do this to you. Yeah. Right. So it's more collaborative. So that gets more like in birth, it's important, if someone is going into a hospital, they need an advocate, like a doula, because, and to have a plan really written out, because a mom doesn't need to tell me, I don't want an IV, I don't want an episiotomy, I don't want, routinely, I don't want to clamp my cord, right away. I don't want to be induced, because they know that I don't practice that way. If it's needed, then we have a discussion. Okay, I say, this is what's going on. This is what I recommend. These are the pros, these are the cons, or you could do nothing and we'll see, so it's collaborative. The only time and they know this, they know me, the only time I ever have to do something quick without any consent, but they agree beforehand, before hiring me, is if there's an emergency, then I got to act. I save somebody's life. Right. I don't have to say, oh, your baby's not breathing. Is it okay if I, do some resuscitation? Right. So if you're hemorrhaging, is it okay if I deal with that? I have to deal with this. But usually everything is non-urgent. It's a discussion. And that mom needs to feel it's her body, it's her birth. She has the power to make these decisions. I'm not her boss. She's her boss. And the more that people know to take responsibility for their life, for their health, for their birth, it's very empowering. It's life-changing, how that impacts your well-being, aside from preventing trauma.
It impacts both the mother and the baby.
Yeah. And, look, birth is, especially, it's a big deal. It's a peak life experience. It can be the most beautiful, transformative experience of your life that you will treasure forever, even if it's painful, even if there's challenge, there's ecstasy. It's just like how, running the marathon or doing something real. It's very hard, but you could do it and you find your strength. And if you're treated with respect, with compassion, with support, honoring your self-authority, like, this is what's going on, but if we do this and that, it might help with this and that. And they could say, I don't want that, or I want that. And that's their decision. So then they're okay with the things that we have to do, or we don't, you know what I'm saying? It's not forced on them.
Right. Yeah, definitely agree. And when the mother does have trauma that they need to work through, and the babies are experiencing trauma, how would you, how can we help them through that process?
No, that's my other book. Okay, well, yeah, no, the trauma release formula. Yeah, so I'm contacted because I have this huge following on Instagram, right? And social media and Facebook and all this. So I'm contacted around the world by people around the world who have birth trauma, like countless times. I can't tell you how many times, not just in my practice, you know, people coming to me from another practice in person. I'm talking about people online are contacting me. So no, therapy is not going to help that. So we, you know, my training and expertise is using the breath work. So we will, you know, for a mom, for example, we will, it's not about the story, you know, we can have a session to process. I tell her to read my trauma release formula book, because that will give her an idea of what we're doing. They're both out in second edition. It's on Amazon or elsewhere, you know, but we talk about the story, but I want to encourage her to realize that the trauma is in her body, and it just needs to be, you know, processed and released, and through the body. So what I use and what and so it's a trauma informed sort of breath work, incorporates a lot of somatic experience. You know, Peter Levine is the father of trauma research and healing and somatic experience. So we use a lot of that in the breathwork sessions. And the basic, you know, the basis is learning how to breathe in this way, you know, the guided sessions, learning how to breathe in this way. And then we use a lot of, you know, the power of visualization and intention. So for example, it's not like I want to heal my trauma. I want to feel free. I want to feel joy. I want to feel calm. Right. So inhale, calm, exhale, free, inhale, let, exhale, go, inhale, let go, let God, exhale, you know, not like I want to not be anxious, right? So it's very powerful when you bring that in, because we're going into the subconscious. And so part of it is learning how to breathe in a certain way. And the other part is learning how to embrace all the sensations and noises and movements that are happening in your body. Just let them happen. Even some will hurt, some will not, some will feel good, some will don't. And just trust the process that your body is doing whatever it needs to do to heal. I've had people go through experiences where they actually go through certain motions to sort of work it out. And the shaking, it's very normal. It's normal to have like sort of tingling and you know, there's all sorts of normal sensations, but they will release, and whatever's released, if they embrace whatever, you know, like, oh, cool, I feel, you know, a pressure in my heart, you know, I'm going to have a heart attack. So I'm going to say, no, you're not having a heart attack. It's safe to breathe. It's safe to feel, you know, so it's, I'm midwifing that person. So we have, you know, sometimes people just need a few sessions. It's not like years of therapy, right? It shaves years of therapy. And it's amazing. People just say, wow, like they feel like free, like someone just put down 3,000 tons of bricks.
Yes.
Right. So healing the adult is with the breath work. The baby, it's actually, if you get it at the baby stage, it's a bit easier, you know, sometimes. Yeah. So sometimes that's all that's necessary, you know, sometimes cranial sacral, or, you know, there's other modalities that can be needed, but sort of allowing the baby, validating what the baby went through, and allowing the baby to tell the baby story.
We've paused.
There are therapists who specialize, this is in my book, but there's a very trauma-informed midwife, Karen Strange. I think on her website, she has amazing resources of therapists who specialize also in healing for the baby. I don't know where we cut off.
Well, we were just talking about how our the babies can work through it through craniosacral therapy and other modalities.
But really just calm, skin to skin, dim lights, soothing voice, reassuring, validating the baby. Baby's not a bad baby because it's fussy, you know, or colicky or hard to settle. That baby is telling a story and just needs lots of love and to work it out. Within the worst thing that we can do to anyone who is having an emotional experience is, you know, encourage them to repress it, stop it, bury it, deny it, escape it, numb it, right? That then it's not going to get processed. Then it's going to come out later in problems. Right.
Yeah. And in the adult life, and then I feel like that's harder to see then.
Yeah, but I'm just saying that I mean, I've had abuse as a child myself, and I've had adult, you know, certain other adult traumas besides my birth, and I've this stuff is gold. This breath work, the fact that like feeling that I was healed, you know, from it, it's gone. Like I have to share this with everybody, right? Yeah, there was no way I thought I would be able to heal all that, but it's possible. And you know, there's people that have way more trauma than that, and it's possible. It's not a life sentence.
Right. Thank you so much for all the insight that you shared with us today. Is there anything else that you feel like we need to circle back to, or we need to touch on that you feel like is really important for us to know?
Prevention is the first thing, you know, prevention, you know, about how think about how you want to bring your baby into the world for you and your baby, you know, so that's my course, my Love Your Birth course, and my Natural Birth Secrets book. That's if you prepare and educate and empower yourself, you can, you know, prevent a lot of this stuff. And then, you know, that, you know, if you feel that this happened to you, you know, there's resources. There's, you know, you can always people can reach out to me, or there's, you know, work with, you know, I'm not the only one. There's trauma, there's people, breath workers that deal with trauma that are pretty much around the world, you know, but it can be done online. But I'll tell you something funny. Somebody flew out to me from Australia. I'm not joking. To do 20, she did 20 sessions with me. I'm like, what do you need to come out from Australia to New York? Like, you know, she's like, she read my book, Trauma Release Formula, and she just related to it. But anyway, I said, there are breath workers in Australia, you know, whatever, she connected. But I'm just saying, it can be done online. It can be done in person, and there are breath workers around the world. You just have to look them up and see who you vibe with. They have to be, you know, I like Clarity Breathwork because it's I think it's has a bit more of a feminine approach, very supportive, yogic, and it's trauma informed, very into the somatic experience, and incorporates a lot of the modalities, so that, you know, you can look them up online.
And I just wanted to add, like, for anyone to find like a practitioner, someone who they feel honors their wishes, and someone, I feel like how you are mirroring to the mothers to trust themselves, like to trust their body. I feel like that's something that,
and to own their body, like own it, own that's your body, your birth, your baby.
I feel like that's what came through to me from the way that you approach birth, for women to trust their body. And
just like your lungs are breathing. Like, you have to think, are my lungs breathing? Like, I'm talking not someone who has asthma or, you know, some illness in the lungs, but like a healthy lungs breathe. You don't have to think about it. You don't think about your healthy heart beating. Your body knows how to birth. Your body was designed to birth. Right? So we trust it. And the most of the work that I do with people is to help them remember what they forgot. It was just, you know, for the vast majority of history, we've been birthing, or we wouldn't have been here, and in the mid 1900s, we started interfering when birth was moved to hospitals and obstetricians took over the whole thing. But in much of the world, still birth is happening at home.
Mm-hmm.
Still happening. It's just normal part of life.
Yeah.
On the farm or wherever.
Uh-huh.
Yeah.
Thank you so much. I have 2 light questions that I like to ask just to wrap up the conversation and on a little lighter note. If you don't have anything else that you want us to know, if you don't have anything else that you want to share.
Prevent.
To prevent. Yes.
Yes.
Okay.
Anyway.
One of them is, what is lighting you up?
What is lighting me up?
These days, yes. What is lighting you up these days?
What lights me up is because I hate social media. I'm off it. I'm off the news. I'm off social media. What lights me up is using it and reaching out to I have such a huge following, and people are responding and telling me, it lights me up that I'm to change a life, to inspire, to prevent this, right? One birth, one mom, one family at a time. That lights me up when I get these love notes that, wow, you changed my life. Like I had this woman from Nicaragua. Well, she's from the States, but her work was in Nicaragua, her husband's work. And she was in a very rural area, and there was no option other than this obstetrician who didn't know anything about natural birth. And all he did was inductions and cesareans and very highly medicated birth. And she took my course, and she was like, I want to, she was educated and empowered, and went to him and said, I want a natural birth. I want you to sit there and do nothing. I want you to, don't disturb it if it's going well, just be there in case. And he's like, I don't even know what that is. And I'm not trained that way. And she educated him, and he did it. And she sent me this video of this most beautiful natural birth. And the doctor was in tears. It not just changed her life to have this birth this way, but just think of the ripple effect that will have on the other women that this doctor cares for. That lights me up. That's how we make change, when we empower women to speak up, and their families to speak up for what they want. And that's how we make change, right? Also lights me up is I do Dr. Joe Dispenza's walking meditation almost daily, and my yoga practice and dancing, and I love to laugh. I have a lot. My grandchildren light me up, my family, my kids and their spouses. So I have a lot of the beauty of the world. I just have to be off the news.
Yeah. Yeah. I love all of those. I love all of those. I love that that all of those things light you up, and I'm teary-eyed, because to me, for someone to see all the things that lights them up, it's such a beautiful thing. I'm one of those people that just like going out in nature and looking at a leaf and the way that its texture is and the colors in it, it lights me up.
Good. Nature. Oh my God. Yeah. The beauty of nature. That's a big one.
Mm-hmm. Mm-hmm. And our last one is it's a silly one, but I love it.
It's silly.
It likes me. It lets me know a little more about my guests. And it's, if you were an animal, what animal would you be and why?
I have 3. You
have 3? Yeah, it's okay.
Well, part of me is a dolphin. I love I think, like when they say, what's your spirit animal? 3 come to mind. Something about the playfulness of the dolphin, the smoothness of which they just go, they're one with the water, because I'm very attached to water. Like I'm turned on by water, being in it, seeing it, natural water. And dolphins are very intelligent creatures, and they doula each other. So when one dolphin's in labor, another female dolphin will be with it. And they like to play and perform and be silly. And, even I'm not talking about the ones who are trained, like in the wild, I've been in boats where they like to follow the boat, and they like to, do all their they're fascinating animals. They're very healing. A lot of people that have all sorts of illnesses will swim with dolphins and will get that sort of energy from them and heal from all kinds of ailments. That's one. Another is the Howler Monkey. Well, first of all, they're crack me up, and I go to Costa Rica a lot. And I'm very agile, and I like to climb and do all kinds of, I love, they're just very smooth in how they jump from tree to tree, and they baby wear, and they're breastfeeding, and it's no big deal. And I see them in the trees just living their life. They also have a sense of humor. So when a lot of people just like look up at them and wow, look at those monkeys, they'll throw things down. They're funny. They're funny. And then the other one is a bird. Oh. Like some sort of a big, I don't know, big, beautiful seagull or pelican or hawk, just flying free, because we're all free spirits, and just to be able to be free is and fly on a physical, but also on a more of a an allegorical, or that we should all be free to be ourselves, be who we are, and those are the three.
I love all of them, and it's crazy because for me, I would be a bird too.
So really? Why?
I would, the freedom of just being everywhere on my own time.
Yes.
The ease is just
so beautiful and graceful how they fly. I could just watch. Yeah. Like when you're at the beach and you just watch, or anywhere, when you just watch how they just glide through, and then they form formations. And what I like monkeys is they're community animals. They live in a pack.
Yeah.
And I like to have my tribe, my pack.
Yeah.
I think we all need
community. Mm-hmm.
Yeah.
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 Thank you so much for being here. I really appreciate it. It really lit me up to be in a conversation with you. Thank you.
Thank you guys so much for tuning into this episode. There are so many other episodes coming your way with so much goodness and so much value, so don't forget to subscribe.